Welcome back to the channel. Today we'll be covering the last part of our topic exodontia. Now we have read in last class 6 fundamental steps. Now going through one by one. Raising a flap. What are the indication for raising a flap? First is to increase the vision, to gain surgical access, to remove bone and to avoid injury to soft tissue. What are principles for flap or raising a flap? Base of the flap must be wider than the free gingival margin. Base of the flap must be wider. Not like this. It should be wider. Base of the flap should be wider because it allows more blood flow and good healing. Okay. Now coming to flap must be larger enough to allow easy access without stretching. Flap should be wider enough to allow easy access without stretching. Flap must be full thickness and includes periosteum when reflected. Means we should raise mucoperiosteal flap. Okay. Incision that outline the flap must be made over intact bone. Incision that outline the flap must be made over the intact bone. Access and visibility because after surgery flaps go back to on the intact healthy bone. Okay. Now the flap should avoid injury to the local vital structures. For example, in mandibular teeth extraction, vertical releasing incision could damage the lingual nerve and the mental nerve. Vertical relesion can damage lingual nerve and the mental nerve. And in maxillary teeth extraction, vertical releasing incision in the posterior aspect of the palate could sever the greater palatine artery. So we should be very careful while raising or giving the incision and to avoid the injury to the local vital structure. Releasing incision should be used only when necessary. Okay. Now removal of bone. Bone is removed to expose tooth in order to provide a point of purchase for sectioning of tooth in multiple root cases and to provide enough space into which the tooth may be displaced. The bulbous root of the tooth. Okay, in case of bulbous root of the tooth. What are the points? A point of purchase to section the tooth and to provide enough space into which the teeth may be displaced. Okay. Now sometimes we use mallet and chisel. Maxillary bone is much more porous than mandibular. Mallet should follow with the sequence of taps. Okay. Advantage: ease of autoclaving, no irrigation required. Removal of bone using dental burr, number 8 or rosehead burr is used. More easily cooled by water jet. Site of cutting more readily seen, easier to control. Okay, these are the advantages of mallet and chisel. But some people say it's not good as it's got trauma to patient because the site of these practice is not cool or good to the patient. But some people find is very good compared to burr. Now coming to tooth division. Lines of withdrawal of different roots conflict. Teeth section using either osteotome or pared handpiece. Separate the root mass of the lower molar from below upward. Below upward. Why it is below upward? Because if burr dips it will go in the air, so not hitting any structure. Okay. अगर बर्ड स्लिप करता है तो वो सीधे एयर में जाएगा तो कोई वाइटल स्ट्रक्चर को हार्म नहीं करेगा, इसलिए बिलो अपवर्ड. बिफोर स्प्लिटिंग द रूट, पॉइंट ऑफ एप्लीकेशन टू फैसिलिटेट द डिलीवरी ऑफ रूट्स मस्ट बी मेड. ओके, पहले स्प्लिट करने से पहले पॉइंट ऑफ एप्लीकेशन बना लेना चाहिए रूट में जहाँ से डिलीवरी होगा रूट का. This is all for tooth division. How to section tooth. We can divide both root also. We can divide the crown and root also. That's called vertical sectioning, horizontal division. That's all come in. We'll deal all this more detail in impaction. This is just transalveolar. So I have given you some idea about this. Now wound toileting. What is that? The betadine irrigation we give or we do is that we call it wound toileting. Why it is important? Because it progress of healing and the amount of after pain is greatly influenced by wound toileting. Okay. Now coming to primary closure, surgical defect must be sealed from the oral environment by replacement of the flap so that no infection should be there. The flap acts as a primary dressing and contains the osteogenic layer of periosteum which help to promote regeneration. Okay. Now, what are the complication after complication during and after? That is intraoperative complication during transalveolar extraction. What all can happen? Fracture of the tooth can happen. Injury to adjacent teeth can happen. Fracture of alveolar bone. Fracture of tuberosity in case of maxillary extraction. Root displaced in sinus. Mucosal laceration. Hemorrhage and subcutaneous emphysema. Emphysema is air entrapped underneath the skin. Now, what are post-operative complication? Hemorrhage, ecchymosis and hematoma, swelling, pain, dry socket which is due to dislodged clot and infection. These are post-operative complications and these are intraoperative complications of transalveolar extraction. Okay. We give post-op instruction also. You should know that we tell the patient the gauze or the cotton which we have given, it should be taken out after some hour. He should have ice cream for vasodilatation effect. And then many on instruction, you should not eat hard food from that side, not brush, don't spit the blood outside, take inside for 1 hour. This all instruction, post-op instruction should be followed after any extraction, normal extraction, transalveolar extraction, impaction. These post-op instruction should be followed. Okay, if necessary we give medicine, if not we didn't give medicine. Medicine is followed by analgesic, antibiotic and one antacid. Okay, that's all for today. Now we'll start impaction in next class. Till then, goodbye. Like, comment and subscribe.